Hi, I'm Dr. Noelle Lucas, and I work at Blue Oasis Pet Hospital, and I am here to answer questions that you might have regarding your cat's pain and pain medication specifically. I have an assistant, Alex, that's going to ask me a few questions regarding cat pain.
Dr. Lucas, how will I know if my cat is in pain, and what are some of the signs and symptoms of pain?
So cats in pain often don't really come out and really tell you that they have pain because they're animals, and they don't sympathize with each other and tell each other that they have pain usually. But cats are usually going to get a little bit more reserved, meaning they're going to hide more from you. They may lash out at you if you hit a painful area when you're petting them. They may just be more reluctant to want to move around the house if you see them out, or stop jumping higher. They also may not want to eat or drink as much because they have pain. So they kind of act a little bit more reclusive and uncomfortable when you pet them and interact with them.
Why is it important to avoid self-diagnosing pain?
Self-diagnosing of pain. So again, you're going to know that your cat is a little off, or they're not feeling their best, or something's just, we call it ain't doing right. So ADR, not doing right, which is a way for them to kind of tell you in their subtle way that they might be having some pain. And nobody wants an animal to suffer. So you really should just schedule an appointment with your veterinarian and have them assess your cat and do a good physical exam, and we might be able to figure out where that painful process is happening.
What are some possible conditions that can cause cat pain, and what are some of the pain treatments?
Yeah, so possible, kind of the most common thing I think of immediately with cats in pain is some kind of trauma has occurred. So they've been outside, they've gotten bitten by another cat. Sometimes they won't have any visible injury, but they're actually getting an abscess, and it causes a lot of discomfort and inflammation. Trauma where they have been maybe hit by a car and maybe have a lameness, or they're not using their legs very much because they're injured and they're hiding. Maybe they have an orthopedic injury, so they are getting older. So arthritis happens in older cats, and they don't want to move around as much. Maybe they're not grooming as much. Cancers are painful processes for cats to have. Oral diseases. We can kind of go on and on with different ways that cats can have pain, but kind of keep it to themselves.
What types of pain medications might a veterinarian prescribe for a cat?
So we have to be careful with cats because they do have their own unique sensitivities to medications in general. So that has limited our ability over the years to treat cats with pain, but lucky we live in a modern time of medicine, and we have a lot of new innovative products for cats that have come out over the years that I've been a veterinarian, and we do have quite a few of prescription pain medications that we can use for cats.
And what's the most important consideration when it comes to cat pain management?
We want your cat to have a pain-free life. So we do, you do. When it comes to what medications we're going to use, it comes down to what do we think is the source of their pain. So we're really only going to be able to tell that when we partner with you and do a good physical and figure out what that pain source may be, and then maybe do some trial treatments to see if we can make that cat feel better, or do some diagnostic tests to find out what the underlying cause is. And we really would like you to really search out a veterinarian in your area, or here in Mount Juliet, we're at Blue Oasis Pet Hospital. If you feel your cat may be in any kind of pain, please get them to a veterinarian. Thank you.